Okay, guys, are we ready to get going? So this afternoon, we're going to be hearing from early career perspectives in the PhD projects. Welcome to Lorena, who is back and is going to be our respondent for this afternoon. So we'll see how it goes. We may have two of the presentations and then have a chance for input and discussion, and then the other three, or we'll go through all of them depending on sort of how we go. We're going to be quite strict with time. So you have 15 minutes. I will give you a heads up when 10 minutes has gone and then when the next 3 minutes have gone. Okay. Yeah, so we're starting with Blessing and over to you.
Thank you so much. Good afternoon, everybody. I'm Blessing, and the project that I'm going to be presenting on is on cross-border mobility and pandemic preparedness, a case study of cross-border truck drivers at the Zimbabwe-South Africa border. And my supervisors are Prof. Joe and Prof. Julia. So the study came from the fact that pandemics come and pandemics go, and probably these pandemics are gonna come back again. So there is need for us to be prepared or for us to be aware of the things that might be coming in future. So when pandemics come, usually they trigger public health responses, and these public health responses are intended to protect life or to minimize the spread of the infections or to minimize possible deaths that can come from the pandemic. And this is what happened during the COVID-19 pandemic. When it came, um, many countries, including Zimbabwe and South Africa, responded by introducing state of emergencies, which meant that a lot of restrictions were put in terms of the freedoms of the people. And amongst the things that were curtailed during this period was the freedom to move from one place to another, be it locally in South Africa, where people were not allowed to move from one province to another or from their area to the next area. And it also led to the closure of many ports of entry, be they airports, borders, and the intention was really to stop the movement of the disease from one place to another. But during this same time, the my apologies that the poster is quite cramped, so you might not see some of the things, but it uses the biopolitics framework, trying to understand the responses that were put in place by different or various governments. And in this context, we would take it to understand that the biopolitics had or the intention was to protect public life, was to protect the lives of people, was to minimize the spread of this disease. But for it to work, it had two conflicting logics where some people were allowed to move and some people were not allowed to move. For an example, when the COVID came, everyone else was told we must stay at home to protect ourselves. We must close our borders. We must close all our port of entries. But then to sustain life, there were some people who were supposed to be moving or who were supposed to be working. And this comes into this is where the truck drivers or the cross-border truck drivers are invited into the study, as they were amongst the few people that were allowed to move during this COVID. They were given a title like they were designated as essential workers. And it is from this perspective that this study seeks now to understand what really came with this designation of being called essential workers. How did it impact or how did it inform their lived experiences as they move from one space to another, from one epidemiological region to another? We can agree, maybe, that during the pandemic, it is only those people who were moving in these spaces who can attest that all the public health um, responses that were put in place were really working or were not working, because these are the people who were in the space. So, like I said earlier on, this study uses a theoretical framework which combines the biopolitics as well as the necropolitics. So my understanding of how I wanted to put it across is like a spectrum, where on one end we have biopolitics, which is seeking to sustain, to maintain, or to protect life. And on the other end, we had unintended consequences of the responses that were put in place with the idea of trying to protect life or with the idea of sustaining life, but they might be inadvertently end up exposing certain populations to unequal exposure to disease or for them to contract disease. In this case, focusing on the cross-border truck drivers, as they were moving, or as the public health was trying really to maintain or protect life, how were these people exposed to disease? How were these people were exposed to near-death experiences? So this is how I view these theories at a spectrum, and trying to understand that the first thing, the initial intention was to protect life, but sometimes because of maybe limited resources or different ways because of context, they might have exposed certain populations to different near death or death experiences. So the main question this study is trying to ask or to understand is how did the interplay of between biopolitical pandemic responses and mobility governance frameworks at the South Africa-Zimbabwe border during COVID-19 shape the living experiences of the cross-border truck drivers. So to try to understand this, I'm sure today now, since 2019 until now, it seems to be quite a long time now that some of the things might have been lost in time. In this study, I tried to understand the pandemic period as from 2019 to 2022. So this is the period when the COVID happened, and you can attest this time is long gone. So in the methodology that I tried to use or try to find out or to explore these experiences of the cross-border truck drivers, I tried to introduce or to use some retrospective elements. In this case, these retrospective elements, their main responsibility or duty is to try to elicit some memories or to make sure that it at least makes the drivers to remember some of their experiences and as they experience them during the pandemic. So the study in itself used in-depth interviews and as well as key informant interviews, as well as some retrospective kind of observations where I went on to look at the routines of these drivers, what they do every day, and then ask them what was different during COVID and what was different before COVID and what is now. And those questions or those observations that would make them remember or would make them give me at least an experience of what was really happening during those times. And with the interviews, I tried to use memory eliciting devices such as photos, such as newspaper articles, and some videos from the COVID period. What does this remind you? Like most people who in South Africa would remember when the president started addressing people, they said, fellow South Africans. And what memories does it bring to the people? Does it bring to the truck drivers and all what was happening? And I think in one of the journeys that I had with the truck drivers, the moment you saw the police, they stopped them. And you see the police coming into the truck. You know what the police do? They want to try and check. They want to get the license and etc. And the truck driver was asking now, if the police was still doing the same thing during the COVID, still taking my license, still getting in the truck, were they not also afraid of the disease, or was it meant that the disease is only coming from the drivers? So it is only for this information to come, it was because as we were traveling or as we were moving in that space, we saw the police and it became a familiar experience. And from that familiar experience, it became a contact point for me to ask, what was your experience and how is it now? And how different is it from that space? And as we move on, this study, I think, since it's a qualitative study and stuff, I'm going to use thematic content analysis, and I'm going to be assisted using the Atlas TI. So I'm not going to dwell much on that because it's a field that is yet to come. But as I was in the field, there are quite a number of ethical experiences that I had proposed that I'm going to use during the study. And amongst those that I've encountered, those I experienced that to have a bit of challenge was to access these drivers during their work time. Sometimes it felt intrusive getting to a truck driver who is having their own lunch in their own space, in a space which I'm not paying for their time. In most cases, they are rushing because they have targets to go and cross to Zim. So in most cases, others would come to ask you, what am I going to benefit from this? Not because these people really need money, but because sometimes I'm being intrusive in their own space and time. And sometimes they would feel I'm working for someone, or sometimes they feel that I must be really taking lunch in this space. And the other ethical issue that I think it was or still an issue was coming from the idea that when you get to these people, after working with the project, James project at the same time, where at least we were having a little bit of not reimbursement for their time and space, and now coming back as blessing, doing my own project. But now this time around, I'm telling them, hey, I don't have water, I don't have a 50 rand. And at some point, you know, that dilemma where the people, but you're the same person. This is coming from the context that some of the key informants that I interviewed were also used during the GEMS project. Then, so those are some of the highlights that I think I would highlight on that. Then I've managed to go through about 30 interviews and still have some outstanding 5 key informants interviews and was some observation visits to try and see what was happening. But uh, before I conclude, I would want to share at least a few of the observations that I've really observed from the field. The challenge was initially I intended to have the study across the border, like moving both to Zimbabwe and South Africa, but it was quite difficult for me now to execute it on the ground. So I had to suggest and propose some changes in that. And then in this study, there are also some of the issues which are emerging already as I'm collecting data and trying to see what are the people talking about. And most of the things that some of them, these people are talking, the participants are talking about the inherent discord which exists in the coordination of mobility health or mobility governance in Southern Africa, which has been also been talked about by other scholars like Joe Maple and stuff. They've already, but this is so much coming out. If you notice, like a country like Botswana, which has been like that, it's so difficult for these people who are moving these spaces to get health in the DRC. So this is some of the things that is coming out. And also, you look at the idea of biopolitics and necropolitics, where sometimes there was inadequate application of these pandemic responses, and because of this inadequate, because of lack of resources or support, bodies became the site of regulations, the bodies of these truck drivers in themselves. And some of some of the themes that are coming out has to do with um, occupational distress, which is coming with these drivers being isolated from families, working for long hours, waiting at the borders, and sometimes bereavement itself. As COVID was happening, they had also their relatives dying, but they had no stop. They will be driving because they are needed to sustain or to promote life. I think I can end here. Thank you so much.
Thanks so much. That was perfectly in time. In fact, you have 2 minutes left. If you've got questions, please make sure you write them down or just make sure you've got them ready. We will have the next presentation and then we'll perhaps do questions then. Okay, over to Lydia.
Afternoon, everyone. My name is Lydia. I'm a postdoc at ACMS. So I'm going to present a paper, but it's not yet a paper. It's still an idea from our GEMS project. So before I could tell you about this idea that I have, I want to share a brief story, but it's related to the paper. So during my third year, that is 2 years back of my PhD, we were asked to do a photo voice, which we did again during was it last week or this week? Last week, yes. So we did a similar exercise. So I looked at migrant women and how they access health services. We use the same pictures, and then you would just post the pictures and then ask other people what the pictures meant. For me, the pictures that I took, it was related to how we access the healthcare services and the restrictions around it, to say if you're a migrant woman, they don't even, these healthcare service providers, they don't even care about what's the problem with you. Even if you go there in full labor, they will be asking you about your status in the country. What are you using? Is it a passport? But you are in full labor. What you need is for them to take care of you. So that is what I looked at. And then I also took part in one of our PhD student project. She was also looking at how migrant women access maternal health care. And then when she finalized everything, there were some, I could term them shocking findings, to find that some of the decisions that these migrants take, which pertains their life, it's to do with the healthcare access. Because somebody will tell you, I wanted to have 2 kids, but the way I was treated in the hospital, I'm never going there back again. This is my only child, the treatment that I received. And I can resonate to some extent to say, as a migrant woman who have used the public hospitals, I really understand what they are talking about. Because some of these they're called front what? Yes, they are so difficult to deal with, even on simple issues. So some of these decisions that these migrant women take about their lives, it's not to do with money, it's not to do with where they are, it's not to do with anything, but it's to do with the treatment that they received from these frontline services. Okay, going to the paper that I'm working on, I've got 2 topics. I'll just read them out and what I've prepared. The first one, but I'm still trying to refine which one would I work with, because this is a paper that I'm preparing to present at the webinar that Prof. Nunes is organizing. So I'm still I'm still trying to make it work. The first one is reproductive rights in limbo, an exploration of migrant women access to healthcare and reproductive services in Musina, South Africa. And then the other one is healthcare as a human right. The reproductive rights imperatives explores the intrinsic relationship between healthcare, human rights, and reproductive rights. In this topic, it emphasized that healthcare is a fundamental human right. Every individual is entitled to access quality health care regardless of their race, age, income, and social statuses. Just to refer back to last week, when we were in the Senate room, I forgot his name, when he was presenting on health, he did mention quite a number of things which caught my eye about the Constitution, that don't just quote things but refer to the data when it comes to these issues of health care. When he said the Constitution guarantees health rights for all, including migrants and all those things. I'm sure those who were there in the Senate room, they heard what he said. And then reproductive rights are an essential component of healthcare. This includes maybe family planning, maternal health care, abortion services, which are critical for individuals to make informed choices about their bodies, their health, and their well-being. And then the key issues that I'm looking forward to explore: access to reproductive health services, looking at availability, affordability, accessibility, including these that I've mentioned, your family planning and others. And then maybe I'll also look at barriers to reproductive health, looking at your socioeconomic, cultural, systematic barriers that limit access to reproductive health care, including maybe issues such as poverty, stigma, where these people come from, and discriminatory laws. 5 minutes. Okay, let me try to wrap it up. And then my research questions, I'll be looking at the primary challenges, of which just to refer to the data that we already have that we were collecting in Musina, we found out that many women couldn't access the basic health care, that they are denied access to these hospitals. So talking about reproductive health care, it becomes another issue if you cannot access the actual health. The first one, for you to go further to say, I'm looking for maybe family planning, while least you couldn't even get inside the hospital. It's kind of far-fetched. Then those who had access to healthcare, majority of them experienced inhumane treatment from the nurses, and most of them chose not to report because of fear of further bad treatment, and because of their status in the country. While other internal migrants reported similar experiences, they were also able. These internal migrants, I mean people from South Africa who are also found in Musina, they were able to report or to stand their ground against these abusive nurses, if I may say. We also found that without proper documentation, these women continue to suffer, and this does not only affect them, but it affects also their decisions to reproductive rights. Some of these women, they've acquired the ones that we interviewed, a bit of some primary education and some secondary, which further makes them vulnerable. Majority of them could not make informed decision regarding their reproductive rights. This limited access to health is further alienating them and rendering them more vulnerable. Yeah, I think just to add a few things before my time could end. Okay. The other question that I'm going to look at is these are sub-questions from the main question. How does limited access to healthcare impact the reproductive health and rights of these migrant women in Musina? What I put down was we cannot speak about reproductive rights if they cannot access basic healthcare. Because we found out that due to these hindrances, there were unplanned pregnancies which were reported due to lack of healthcare facilities, further exposure to maybe chronic diseases such as HIV and others. The other sub-questions that I'm going to look at as I develop this paper, what reproductive health services are available for migrant women in Musina and how accessible are they? We found that some women reported that access to health care was very limited, which in turn limit their choices, even if there were some NGOs which were very helpful in giving referrals to these migrant women to healthcare, but due to ongoing funding cuts and everything, this also affected them. We also found that it was a very cumbersome process for these NGO health providers because it was reported that some nurses or whoever in these healthcare services providers would turn away these people, even if they've got referral letters. We even had the people that were presenting last week on health. They highlighted the same issues. Even Tifa highlighted the same issues. They were also facing the same issues to say, well, they have to accompany them. How many people are you going to accompany? It seems like you do not have other job, even a service provided. You will be having a full-time job now to accompany people to the hospitals. Also, the issue of affordability. How many of these migrants are able to purchase whatever that they want in the pharmacies or private doctors? Only a few of them, given their very precarious jobs that they are doing. I think I'll end here. Thank you so much.
Okay, thank you for this exciting project. So for Blessing, yeah, I can see you have already interviewed Zimbabwean, South African, Zambian, Malawian. Where's Blessing?
Yes,
Yeah.
yeah.
So the interviews are conducted.
Sorry?
You have conducted the interviews already.
Yes, yes.
Okay, that's fine. Yeah, I thought you were preparing to. No, I think it's an excellent, interesting paper. I was just thinking, obviously these are men right? Men truck drivers, and to think about issues of masculinity and truck drivers culture, which is a quite distinguishable set of ways in which men navigate this profession or this activity. Blessing, I need to see you. Otherwise, sorry. So otherwise I feel like you can, yeah. Yeah. Yeah, thank you. Thank you. Thank you. So, so in that sense, I would also reflect on that men masculinity, truck drivers culture, but also this label category of essential workers. How do they feel? How they kind of inhabit this category? Do they perceive themselves as essential workers throughout, or COVID put that label on them? And how, in terms of identity, how they construct themselves an identity, or felt themselves in a particular way in the context of this pandemic, right? Questions that I was asking myself as you were going through, because it's that they don't stop being essential workers post-pandemic. It's just that during pandemic, they were granted certain rights or certain abilities to move around, and also vis-a-vis, on the one hand, you have those legally designated essential workers in the context of pandemic, vis-a-vis the informal workers, for whom work was essential, but didn't have that entitlement, and they didn't have any protection. So I will play a little bit with the essentiality, or what the label of essential, right? In kind of like at the same time denying that work is essential for people, particularly those who are self-sustained in the informal sector. So that paradox. Then necropolitics, you didn't explain very well. You mentioned it, but I'd like to know more about it. What else? There was something else. I think that pretty much is, yeah. Yeah, that's my comments to you. Thank you. You can go. Okay. Yeah. And then more comments before we move? Yeah.
Yeah, I think
Yeah. In relation to my areas of questions, right? The issue of masculinity, the issue of truck drivers culture, the issue of being essential workers as a label that comes into place during pandemic, but there are essential workers throughout. Necropolitics, and the essential worker category vis-a-vis those who were not considered to be, who were less part of the official response, were actually left aside, marginalized.
Oh, thank you so much. I'm sure moving forward, your feedback is gonna be useful. And some of these categories, or how you framing it, are already coming out as I'm collecting the data. And fortunately, now you have to help me a lot to try how to meaningfully report back to what really was that, especially on the issue of essential work.
Yeah.
When, if you find out, most of them, as they responded to some of the questions, they thought it was just any temporal title that they were given, without necessarily being essential in any case, because most of them, they report that during this time, this is when they even lost their salaries were cut half, and they didn't get really enough support, like in terms of that distinguished that they were essential, but they were out on their own fighting. This is how they feel. So I think it is very important to query and quiz this term essential work, and especially bringing other informal essential workers that were not really protected by law, and really versus those who were assumed to be protected by the law. Then coming to the issue of necropolitics, how I wanted to frame it, or how I want to put it across is, and this is where certain governmentality rules expose certain populations to death or near-death experiences or exposure. That is the concept, not really taking it far to the Mbembe kind of necropolitics, but this is where I'm coming from, where I think some rules or some regulations which were intended for the good of public health, but then unintentionally or inadvertently exposed these so-called essential workers maybe to the disease which would eventually expose them to death. Yeah, thank you.
Okay, Livia, I'm super happy with your proposed papers, and I think maybe at this point, since you have collected all that information, and at the same time you have an idea of what are the bodies of regulations that are not observed, transgressed, or not respected, not attended, maybe a sort of a counterpoint between what are the rights that are there and that are not observed, and the practices, and almost like situations in which women find themselves navigating these barriers. And what I think is important is not just to show that rights are not respected, but the cost on health itself of these barriers and these forms of exclusion. How does it impact, in terms of prevention? On the one hand, from a perspective that actually you end up investing more in provided care that comes late and comes, that does not prevent or protect health. That's one line. And another one will be what women do and what is the agency of women in navigating these barriers. So I would put a frame on terms of, the policies, regulations, just to then delve into your kind of almost cases. And after each case, you kind of take issues there that go along rights, go along the costs of health care when there's so many barriers that people don't get what they need, and what women do to still keep themselves how do they survive, and what are the negotiations, the adaptations, the agency of women. But I would focus more on your empirical cases to show that. And the other thing that I wanted to ask you, what is it that makes a border city different from other places? What can you talk about particularities of this place as a border town and that differentiated? I mean, the whole suspicious that we have seen in South Africa, that people cross just to get or come just to get care and then they go back. Is that the case in Musina? Are people coming to be cared for in South Africa? And if so, is it, what body of regulations does it transgress. But on the other hand, what other bodies of regulation can one appeal to if you're looking at protection of life independently of borders and frontiers? Human life is more important. So bodies of legislation that give value to life and protecting life beyond the fact that you may have not acquired the rights to cross or that you belong to another country. Is it fine, or am I complicating things more?
Thank you for that, Prof. Since it's still a work in progress, I'll try to incorporate everything that you have said to see how far it takes me, because this is actually a very new topic that I'm trying to work on.
Okay, thanks, Lorena. So we have 3 more presentations. Bothwell, are you ready to get started? Is your presentation loaded?
Yes.
Yeah, he's at the back for some reason. So we've got Bothwell, followed by Tola, followed by Stanley. There's once more on the screen.
Good afternoon, everyone. My name is Bothwell Vumai. I'm a doctoral candidate at African Center for Migration and Society. And today I'm going to be presenting my research project entitled Cross-Border Sex Work on the Urban Margins, the Politics of PrEP Access in Gauteng Region. And my supervisors are Prof. Jovieri and Dr. Ovias Katsaura. So just try to establish a link with yesterday's presentations. You remember we learned about how interdisciplinarity forms an important component of research, especially within the migration and health field. And because of that, I had to share a little bit of my background, my research background. So from my undergrad, I'm somebody who is coming from a political and administrative studies background, and I was so much into issues that revolves around public policy and governance. And when I joined the ACMS as an honor student, my research project was on it was a policy analysis on the South African National Strategic Plan on TB, HIV, and AIDS, on how it was engaging with migration and sex work. Then on my master's by research as well, I actually did an explorative study on migrants' interface with missions and state-run hospitals on maternal health care provision within a Zimbabwean borderland. I just thought it was important for me just to share this to show that, how the interdisciplinary component of it is important, especially in the study of migration and health studies. So from there, I moved to my PhD project, which is entitled Cross-Border Sex Work on the Urban Margins. And on this one, I'm just gonna share a little bit of the background of the study. This project, the proposal has been accepted by the faculty, and I'm just gonna share some details. Like, I'm not gonna go into detail like I'm presenting the proposal, the project proposal itself, but I'm just gonna share what I feel these are the important background information that you need to know. So my research project actually, it acknowledges the conventional strands of scholarship that foregrounded and appreciated the relationships or the intricate relationships between migration and health. And I'm glad that in the room we have Dr. Becky and Professor Joe Vieri, who have actually done tremendous work around migration and sex work as well. So you'd find out that in much of the work that I did, I acknowledge them a lot because they are the people whom I can call the gurus in the field. So there's no way I'm gonna lie in their front because they are the gurus or the intellectuals in this particular field. So yeah. So I'm kind in a dilemma because whatever I say, if I say something that is inconsistent with that what they've written, they're gonna point me straight into the eye and say like, hey, you are lying there. Yeah, so my project also acknowledges migration as a vitally important social determinant of health and its increased association with poor health outcomes. It also acknowledges the research on migration, on immigrant sex workers' access to PrEP that has shown global disparities that exist between citizens and non-citizens in terms of access to healthcare services such as PrEP. So migrant sex workers often face higher risks and lower health outcomes compared to their counterparts. This is according to global literature on sex workers' access to PrEP. I also acknowledge how the complex link between cross-border migration, female sex workers, and access to sexual health education and services, how the complex relationship can be understood in terms of how cross-border migration can exacerbate the feminization of poverty. You'd find out that owing to limited economic opportunities, migrant women who normally comes to South Africa, they end up, because of limited opportunities, they end up residing in marginal spaces like townships, informal settlements, and hostels. And they also end up taking precarious jobs such as sex work to earn a living. In such circumstances, cross-border female migrants are exposed to higher risks of HIV infections. Okay. So I also acknowledge that the subject of pre-exposure prophylaxis or PrEP and its intersection with sex work and its intersection with sex work and migration has garnered significant attention in both high-income countries and low-income countries. Its efficacy in preventing new transmissions globally is quite remarkable. As you can see from the statistics from the UN Progress Report, that reported an estimate of 1.3 million new infections in 22, indicating a 27% and 38% reduction from the 2015 and 2010 statistics, respectively. So against that backdrop, we know, like I've mentioned, that Dr. Becky and Prof. Joe have actually done a lot of work regarding around migration and sex work. My point of departure is I would also note that with other scholars that have done work on migration and sex work, much of their research is actually inordinately focused on local citizens themselves without focusing much on undocumented migrants. So in this, my point of departure or point of deviation, I extend and complicate this scholarship first by a deliberate empirical focus on undocumented cross-border female sex workers as the main unit of analysis. So the reason why I'm focusing much on the undocumented female sex workers is because they have certain identities that are attached to them. As you can see, how I've highlighted in bold, you'd actually see that an undocumented female sex worker is actually a stigmatized foreigner, and a sex worker identities in general and an illegalized undocumented status in particular, which largely constrain or inhibit sex workers' access to sexual health services. The female identity further predisposes them to gender-based violence and unsafe sex practices. This situation is always further worsened when coupled to sex workers' illegalized undocumented status, which increasingly compromise their bargaining power for safe sex and non-violent sex, making them more susceptible to risk of GBV and HIV. So you'd actually find that undocumented female sex workers, they actually do have multiple layers of vulnerability, unlike any other female sex worker. For instance, you'd see, like, let's say, for instance, we do have sex workers, like local sex workers, and also those who are documented. But to those who are undocumented themselves, they do have an additional, or there's a multiplicity of layers of vulnerability that others are not also facing. Then also noted that the relationship between cross-border migration, sex work, and PrEP intervention is yet to be closely researched and understood in the context of undocumented immigrant sex workers residing in Gauteng, urban margins, or low-income residential areas. The depth of knowledge regarding undocumented female sex workers' perceptions of PrEP, the power relations that influences their access, since its novel rollout in South Africa in 2015. Considering this scholarly puzzle, this study proposes to explore undocumented immigrant female sex workers' perceptions, experiences of access to, uptake, and adherence to PrEP in Gauteng's urban margins or low-income settlements of Diepsloot and Tembisa. So generally, the scholarly contribution of my study it's gonna come out through a robust theoretical engagement with worldviews on an under-researched phenomena in low-income settlement of an HIV endemic country. This research project shall interrogate and extend research fieldwork and debates on complex relationships between cross-border migration, sex work, and HIV prevention interventions. It will also recognizes the empirical importance of understanding the unique challenges that are faced by undocumented immigrant sex workers residing in these marginal spaces and their access to PrEP, as well as assessing the importance of PrEP as a highly effective measure against HIV transmission and its potential to contribute to the overall health and well-being of sex workers and those who depend on them. Ultimately, the research shall also significantly, that is intellectually and empirically, contribute to global debates on human mobility, sexual health, health equities, and subjectivities. It also bears the potential to contribute to policy improvement by bringing up the subjective and emic views to complement the biomedical constitution and administration of PrEP interventions. Okay, so this is my main research questions. How do undocumented immigrant female sex workers navigate and negotiate access to PrEP on the urban margins of an HIV endemic country? And the sub-questions are as follows. I just want to quickly go to the theoretical framework. So my study is actually underpinned by, it's guided by the Spaces of Vulnerability theoretical framework that was developed by Dillon 2008, 2021 as well. It's also augmented by scholars like Watson Bohe, Hewitt 1997, Washington and Downing 1999, So although this theory is purely from a geographical background, its explanatory schema of why some social actors are more susceptible to social and spatial adversities than others make it adaptable to my study and other disciplinary fields. So this theory is actually key for the understanding of how multiple social, political, and economic inequalities and all factors that shape the susceptibility of various groups to harm, as well as governing the ability to cope and develop resilience. So this is how I conceptualized the concept of vulnerability. It helps us to understand how space and place influence vulnerability and resilience. It illuminates the social, spatial nature and dynamics of vulnerability. Thus, vulnerability is a central notion and experience in this study, as it is integral part of immigrant female sex workers' experience with sex work and access to PrEP intervention in South African marginal spaces. So in terms of its relevance, the spaces of vulnerability theoretical framework is quite vital, as it is key in the mapping of social groups, in the social groups that are part of my unit of analysis, which is undocumented immigrant sex workers. It is also key in the mapping of the marginal spaces themselves. Like I mentioned, that my research site are Diepsloot and Tembisa, because of their locality at the urban margins of the Johannesburg metropolitan. So in terms of my methodology, my study is more of an exploratory, it assumes a qualitative and exploratory design, which places a characteristic thrust on the knowns, the contextualized meanings, behaviors, practices, experiences, and interactions of individuals and collectives. So basically, it's a qualitative type of a research where I will be doing interviews with undocumented female sex workers who are residing in those spaces such as Diepsloot and Tembisa. And in terms of sampling, I'm using two non-probability sampling techniques, namely purposive and snowball to select representative cases of both social spatial sites and research participants. So the main justification for me to choose Diepsloot and Tembisa is because it stems from the demographic. Sorry, I need to. Okay, it stems from the demographic reality that most international migrants are concentrated in these typically socially, economically marginalized enclaves, which provide alternative cheaper lifestyles and livelihoods. Diepsloot and Tembisa and other townships also serve as convenience entries for newly arrived immigrants from across Africa and those who live in the core or the inner centers of the city in search of more and affordable accommodation. Okay. My last words, I'm currently waiting for the ethics clearance certificate. Once I get it, I'm gonna go and hit the ground running in data collection. And that's the main. And there are also discussions that I would want to do with Dr. Beggy and Prof. Joe with regards to reframing my research questions to actually include issues that is to do with the recent withdrawal of the USAID, since much of these PrEP interventions were funded by USAID. So I would just want to find a way in which I would include questions that also caters for such kind of USAID withdrawal, to see how those things affect PrEP access and adherence among immigrant sex workers. Thank you.
Once more, not once more. Bothwell, thank you, Bothwell. And now on to Tola. So if you've got questions for Bothwell, please just note them down or hang them somewhere in your brain. And now we'll move on to Tola, and he's standing.
Good afternoon, everyone. Yeah, my name is Aditola Oyenubi, and before I begin, I would like to acknowledge two wonderful people in the room, the director of ACMS, Joe, and my wonderful supervisor, Becky, because I believe without their support, after a series of very unfortunate events, I won't be standing here presenting this topic. So thank you guys very much. So my topic is on exploring the impact of forced displacement and caregiving roles. Exploring the impact of forced displacement on caregiving roles and experiences of well-being among internally displaced persons in Plateau State, Nigeria. And earlier today, I asked three of my colleagues what comes to mind when they hear the word Nigeria. Sorry, I'm putting you on the spot. And then Melissa said jollof rice and pepper soup. And Persuade said African movies. And Charity said ethnic diversity. So while I was preparing my slides yesterday, I asked co-pilots the same question. I sent that prompt. And it said, well, when people hear the word Nigeria, they think about cultural richness. Nigerian is known, of course, for Afrobeats. We know Burna Boy, Grammy Award winner. We know, of course, our Nollywood movies about the wicked mother-in-laws and the witches and all that. And then, of course, vibrant fashion, opulent and colorful weddings, and literature. We all, at least most of us will know Chimamanda Ngozi Adichie. And then it went ahead to tell me that people think about entrepreneurship and Nigeria as the African capital of hustle. I don't know, maybe that's debatable. And then also, yeah, this is fact now, Nigeria is the most populous African country on the continent, and it has a population of over 250 million people. And so after saying all these nice things and buttering me up, co-pilot says, unfortunately, some might also think of corruption in terms of like cyber crimes, 419, corruption and economic instability, yeah, which are all true. So after all this, it just proved my point, and which goes to forced displacement in Nigeria, which is a huge humanitarian crisis. It's been ongoing for over 2 decades now, and yet it has been under-acknowledged, under-researched, and understudied. And the migration and what's it called? Migration data portal, I think, of 2024 says that currently over 3 million people are displaced in Nigeria, internally displaced in Nigeria. This number might look small compared to the total population of 250 million persons, but 3 million is quite significant. It's actually a big number because about 67 countries in the world have a population of under 3 million persons. And yeah, so this map is the map of Nigeria, and the circles here, depicts spots, hot spots where internal displacement is quite prevalent. And to my, what's this, right? To my right side, especially Maiduguri, is one of the states in Nigeria where, by the way, there are 36 states in Nigeria. So Maiduguri, Yobe State, Gombe State, some of the states where we have the epicenter of Boko Haram insurgencies. Boko Haram means Western education is a sin. So which means that everyone sitting here is a sinner, according to Boko Haram. So one of their high profile insurgency cases was the kidnap of 256 school girls between the ages of 16 and 18 in 2014. These girls were abducted from their boarding school, Government Girls College in Chibok, and on the way to their abduction site, that's Samsiba Forest, fortunately, 16 of them jumped off the moving truck and they were able to escape. A few years later, after some negotiations with the government and humanitarian organizations, some of these girls were released, and 10 years later, reports still have it that 82 of these girls are still missing. So apart from these kidnappings, they have also killed people and rendered many of them internally displaced. And to the right, those dots at the right indicates spots for another form of internal displacement known as armed banditry. So these people, we all assumed were like Boko Haramist, but yeah, they distanced themselves from the armed banditry, so we call them unknown gunmen. So they attack villages, they attacked farmers, and so many people, killing people, touching homes, and rendering people displaced and homeless. And then around the bottom, we have the Middle Belt region of Nigeria, which is also my study site for my research. And it consists of places like Benue State, Plateau State, and the Federal Capital Territory, Abuja. So in Benue State, we had the recent killings like 2 weeks ago, where over 6,500 people were displaced and over 200 persons were killed. So coming to my study site, which is Plateau State, somewhere in the middle. I grew up there, and unfortunately, I experienced the very first insurgency there. And the kind of insurgency there is known as ethno-religious conflict. So there are two main religions in Nigeria, that's Christianity and Islam, and there are also conflicts between, so we have clashes sometimes, and there are also conflicts between pastoral farmers and we call them Fulani headsmen. So they are like nomadic cattle rearers that graze around the area. But then because of the issue of deforestation, so there are hardly places to graze. So they take their cattle to the farms of, people who have toiled for so long, and then they feed on those cattle. And when the farmers complain, they kill them, they rape women, and then the farmers have to retaliate. So that has been ongoing. So in 2001, I, was there to experience the first religious conflict, and I'll just read my experience as I reflect on what happened on that fateful day. So on the 7th of September in 2001, the city of Jos, once celebrated for its cultural diversity and religious harmony, descended into chaos. What began as an ordinary Friday ended in fire, blood, and the collapse of the world we knew. I was a teenager then, and growing up in a Christian household, my family lived peacefully alongside our neighbors. I'll call them the Salisus. They were a large Muslim family household, headed by a kind man and his 2 wives and 14 children. And on that fateful day, just after Jumat prayers at noon, a wave of terror swept through the city. We heard the first echoes of gunfire, saw plumes of smoke rising in the distance, and watched neighbors run to their homes in panic. From the window of our apartment, I watched as terror closed in on us. People screaming, chased with machetes, stones, sticks, and other weapons. What we had only ever heard of in faraway places like Kaduna, Kano, and Borno State had arrived at our doorsteps. It was violence as it tore through our neighborhood, shattering everything familiar. The Salisu family would never be the same again. That day, both wives left to buy school uniforms for their children, and they never returned. Their absence became a haunting silence. No funerals, no bodies to bury, and no closure. These women were not just mothers, they were domestic backbone of their home. Their disappearance thrust the entire burden of care and survival onto the father and the older children of the home. The older children who were once carefree became caregivers overnight, cooking, cleaning, working odd jobs, and raising their young siblings while trying to stay in school. And the aftermath of this was that, due to so much economic pressure, they had to return back, to their village, which was a form of displacement. This is a single story, and many families were impacted by this very conflicts. So many were displaced, ended up in IDP camps. And I guess reflecting on this experience made me extremely aware on how displacement fractures families, creates new rules, and reconfigures relationships in ways that might not necessarily fit into traditional family models. Displacement also has, as well as disrupting these family dynamics, it also has a way of impacting on well-being. And as Langer put it today in the definition of health and well-being, which is like the World Health Organization of description of well-being and health, is simply not the absence of disability of diseases, but it encompasses of social, physical, and mental well-being. So I guess reflecting on this, I believe, makes my study significant and quite important in the area of migration and health. Most dominant studies or literature discusses around forced migration focuses on migration from either a survivalist lens or a maternal-centric lens, whereby you see most studies around family dynamics, talking around the experiences of single mothers in the instances of displacement. But what about older siblings like the Salisu's children? What about aunties, uncles, fathers, grandparents who have to take upon themselves these caregiving roles when the primary caregiver disappears or gets killed in an instance of conflicts and displacement? And how do they interpret their well-being? Does well-being mean a sense of safety in this context? Does well-being mean being able to, provide for their families, and even in camp settings where resources and food are allocated and distributed by humanitarian organizations and benevolent donors? Does it mean having to get their share of these resources? So these are the pertinent questions I believe my study seeks to understand. And so this background and story has set the parameters for my inquiry. And so I ask, how does internal displacement impact on caregiving roles among IDPs? And how do caregivers experience well-being in these new roles? Thank you.
It was perfectly timed. Thanks, Tola. And then we finally have Stanley. Stanley online, or? Oh, Stanley's here. Sorry, I didn't see you there.
Good afternoon. Good afternoon. Good afternoon. Okay, by the way, Stanley Morava Star. So this one is just a proposed research topic, which is open for your feedbacks because it's still a foundation, something that has nothing yet. You know, I have just done some few readings, but yeah, that's the topic. Maybe you can just take a look at it. So, you know, and seek to explore the methodological challenges faced by academics or researchers and strategies they apply when studying the life experiences of human migration in South Africa. And the reason I come up with this topic, since I was in Musina, you know, studying migrants, and there were some situation where we are trying to recruit and then other were reluctant to be part of the study because they claim they are not migrant, you know. And then you find out maybe one of my colleagues recruited them and then they agree, you know. So these are some of the things that I want to explore, you know, and also the strategy that can be applied to mitigate those challenges of, you know, that's not important. And those will be the research questions. What are the key methodological challenges faced by academics researching human migration in South Africa? And what strategy do researchers employ to mitigate these challenges? How do these challenges and strategy impact research outcomes? Or, you know, and those would be the objective to identify the methodological challenges faced by academics studying human migration, to explore the strategies that researchers use to address these challenges, to assess how these strategies impact the quality and reliability of research finding. The methodological approach will be qualitative research to explore experiences and strategies. And the participants will be researchers and scholars specializing in human migration within South Africa. And participant selection criteria will be based on experience, publication record, involvement in migration research. Yeah, this one, data analysis, interpreting, semantic analysis, data collection, will be semi-structured interview with open-ended question. Just a little sample of question that might be included on the interview guide. Well, something like, what challenges have you faced in studying migration? What strategy have you found effective? How do this strategy influence your finding? This will be question that will be asked to scholars or migrant, something like that. And yeah, we all know some of ethical considerations such as, you know, I won't go through it. You know, the most important things is feedback from you guys, you know. And I think that's all for me.
Thank you so much. Short and sweet, that was great. Thank you to all three, or all five presenters, in fact. If you would like to give some feedback on the three, and then are we going to open up for questions or feedback from the room and online? Is that right? Okay.
Okay, once more, no, both well. Please, also, if you could put yourself on the other. Reading once more is on. Thank you, thank you, thank you. So I can see you. Okay. I like to start asking by asking you, what would you consider would be health equity or health inequity in your research? What is it? It's a question for you now so that I can engage with that.
So, for health equity, I would really think this you say, based on the literature that we gave,
No. And applied to your particular case. What is the situation of health equity and what is the situation of health inequity in your research? Not really definitions, but just what would you consider equity?
okay, so equity, I will consider it as in as a way of ensuring that no one is left behind in terms of accessing the sexual, for instance, sexual and sexual reproductive health or health and HIV and AIDS health programs or interventions. So I would frame it in a way that no one should be left behind, because in as much as we think of migration and communicable diseases, these diseases, they do not have boundaries. So in as much as some are left behind, let's say, for instance, the undocumented immigrant sex workers are left behind, it means the effects of it are gonna felt across the divide, irrespective that one is documented or undocumented. So whatever interventions that needs to be come up, to be brought up or to be designed, they should be interventions that are aimed at ensuring that these services are accessible to all. And yeah, I think that's what I would say.
And this relates a bit to what I was talking yesterday in terms of how we study these kind of situations and what are the claims that we are, or the advocacy around this, because in a way you are talking about health equity at the very last end of a whole change of inequities. And that I worry a bit, because we end up asking for equal right to health when there's been so many conditions that make the increase the vulnerability of these communities. That maybe one should start by questioning something like, I would imagine that you will talk about, maybe one can even say a life history where you identify different moments of compound inequity, because otherwise it's like if we are in front of a war and the people dying and we ask for equity so that the wounds can be healed, but there is a war. Can we not say anything about the war? So I'm maybe putting a very extreme example, but I want to say that these forms of inequity are socially produced, and there is not a static picture that you need to account for, but it processes. And in that sense, communities, I will call more on communities rather than, again, calling on what I was saying yesterday, places as a external to social relations. Those places become places of threat because there are social relations that perpetuate, that increase the threat. And those are the things that I invite you to consider, so that we don't produce a static picture and a demand of increasing or being, more timely with the preps. But really, is that only what we can say? I think you can say much more. And my invitation is to open that. And again, these policies also to interrogate them from the side of policymakers. What is the intention? How are they considering mobile populations and documented and so on? And I think it's important to document that. But my fundamental question to you is just let's not talk about the end of the continuum of inequity. That you think, I think one should. Yeah. Paula. Oh, I mean, I think you can write a book about what your displaced community and care, and it's almost like I'm glad that you finally put the question on care and the kind of assemblage of families, and everyone taking other roles of care in absence of those who were supposed to care for, because they were dead or gone. And I think if it's just telling the story. I think it's absolutely necessary how social life is made and remade in conditions of displacement. It's like I can't say more than, please just tell us a story. You have so much and there's so much there that we don't even need to put, a proper objective. So it's just the telling of the story, which I think is really important and necessary. Stanley? Oh, I also need to see Stanley. Wait. Nice PowerPoint. I like the flowers. Is this a master? Yeah. I think. Yeah. Stanley, I think you have potentially a very interesting topic. And one of the things that immediately, resonate on me is that you'll be dealing with researchers that the issue of mobility and immobility or sedentarism. Researchers, we tend to be not migrants. Often we are, sedentarian people that work in centers and stay. And the research tools that we use, the research methodology is also not geared for mobile population. So there is a discrepancy between who you are as a researcher and who you want to research. So I will put the issue of mobility and immobility as a core of your questions in terms of what are the challenges, right? Because the challenges that have to do with tools that are not designed to study those who you want to study. You're not taught unless you take a specific methodology, research methodology on mobile population. This is a sort of a second adaptation to a series of methodologies that we, in the social sciences, we use, which are not dealing with people who move. Yeah, that's in itself is interesting. And researchers as themselves being kind of sedentarian. But there are ethics issues as well. So in a way, it will be like, this, to map out a collection of problems that you encounter when you do research with mobile population. As often researchers are not themselves mobile themselves or tools. And also the other issue that you bring here is South Africa. South Africa, you also need to unpack what is it particular in South Africa that makes this research even more challenging or easier. The issue of, as we know, xenophobia, the issue of illegality, the issue of, not illegality, but undocumentation, and how then these, the subjects of your study are subjects, participants that are scared, that they see your research as a threat, and they may then kind of disguise their condition because they fear the consequences. That, I mean, these are all things that one start imagining that emerge when you think about what are the challenges and how they navigate it and what are the. So I think there is a lot of potential there, and I think you need to kind of anchor your questions in terms of mobility or immobility being in South Africa, to try and sort of, otherwise it could go, you know. I think that's very important, necessary, and I like to see what comes out.
Thank you so much. It's great to be able to have feedback sort of that really from somebody who really both knows, you know, where the research topics are coming from, but also brings an external perspective as well. Because I think often we are surrounded by people working on very similar topics or people who have known our topics from the beginning. So I think to have that that feedback and questions that really make us think more about what we're looking at is critical. So thank you so much for that. We have time, I think, to open up for questions or responses. Oh, the responses from the students. Aha. So what we'll do that, and then we'll go straight on to questions as well. So if Bothwell, Tola, and Stanley, if you would like to respond to the questions, I know Bothwell, you've already responded to a specific question. And then we will open up to any questions or comments that are in the room or from anybody online as well. So, Bothwell, I don't know if there's anything else you wanted to add, or if you want to sort of stick with the question that you were asked, and we'll move on to Tola.
I think I'm more comfortable with answering questions that will be coming from the floor.
Tola, do you want to add anything or respond?
Okay, thank you so much, Lorena. I think, I'm trying to find my voice in my research. So I'll keep working on it. Thank you.
Stanley, did you want to respond to any of the ideas or encouragement that you received?
No, thank you very much for the comments. I have noted them and I have turned them down. So yeah, I will work on them. Thank you very much.
Okay, great. Thank you so much. So can we open up to general comments or questions? Tifa, you want to kick us off then?
Sorry, old age. I was about to forget. One comment for Blessing and one for Poti. For Blessing, I think he's got a very interesting topic, but it's more focused on who labeled a particular group essential workers. So I'll be interested in seeing the chain of, I think the processes of a truck driver crossing the border requires what we call a clearing agent and a runner. A runner is now the human internet who passes the clearance papers from the clearing agent to SARS to immigration. It cuts the waiting time at the border, and also it maintains the original form of the clearing papers so that it doesn't have to be printed, scanned, sent back, signed, printed, scanned. So if a truck driver was regarded as an essential worker and a runner was not, how did that also affect them? Or was that automatic, meaning that if truck drivers are essential workers, so is the clearing agent and the runner? And to Bothwell, I had a particular interest in the concept of leave no one behind. And I'll give an example. Sex work is only sex work if there's somebody buying. And with VIT RHI, they had a key area of interest, which was the index. The index is the person who buys, and whatever affects the sex worker should obviously affect the index. And services was given to indexes without any questions asked. But when it comes to primary health care or the government services, if an index goes by themselves, they're sent back and they're told, come back with your partner because we cannot treat an STI to just one of you. But when it comes to VITA-RHI activity, so I'm glad that he says he wants to incorporate that. And in leaving no one behind, how then does it change the entire spec of the research, since it says it's focusing on migrant women? And the index mostly are also men. So I would want maybe just also an interest, maybe as a side note, just to see, okay, who else is affected by the lack of service towards sex workers, in particular the index. Thank you.
Thanks so much. Is there another question before we go to a response, or? Yeah, sure.
Thank you. I've got a question for Bothwell as well as Blessing. For Bothwell, from my experience working with HIV prevention interventions, as well as sex workers, most of the PrEP was provided by USAID funded programs. And now that this has been withdrawn, how do you think that will affect your interviews? Because the sex workers were more comfortable going to these sex work clinics, which were under DREAMS, under USAID. And after the funding was withdrawn, we have seen them going back underground as well. And then going to Blessing, you have already interviewed about 30 truck drivers. Do you have a sample? And I was wondering, haven't you reached maybe saturation from that 30 that you've interviewed? Thank you.
Blessing and Bothwell, would you like to respond?
All right. Thank you so much. Thank you, Tifa, for the feedback. This was useful. And I think your reflections on the runners could be one of the things that explains why these queues were very long, because most of the times they were not visible. Should they be there, they were illegal. And this would also be seen with these informal food traders or those support services that are usually accompanied with the truck drivers. You know, if you go to the border, to those, especially if you go to Limpopo truck stop, you'd see there's these women who cook food, who provide shelter, and as well some sex workers who are always there giving these truck driver services. But during COVID now, it was very difficult for them to be there because they were not allowed. So you would see some of these informal or hidden services they would say one woman said like they cook this fresh food. So they said the truck driver, once he moves from the truck to wherever they were cooking, they would close the door till the next morning, so that they are not allowed to go back. So you would see now, this is how they were getting these various services. So it was not like as open, or it was not automatic that these runners were becoming official. And then, yes, Sbosiso, I've really started to see some of the things that have been said repeating themselves. So I think I can confirm that we are nearing, or we have almost reached the saturation. And initially the target was actually the 30 interviews, but throughout as I was conducting these interviews, some issues became recurring and no more kind of like new things were coming out, but different expressions of the same things. Thank you.
Thank you, Tifa and Sbosiso, for your questions. Responding to Tifa's questions on the aspect of leaving no one behind, The reason why I specifically mentioned immigrant female sex workers as my unit of analysis, it was mainly because of the theoretical framework that I'm using. So to some extent, it had more to do with them being the ones that are experiencing multiple layers of vulnerability compared to their male counterparts who are in some instances are the perpetrators of some of those things that are actually aiding on the multiplicity of layers of vulnerabilities among immigrant female sex workers. But yeah, I will consider it as well. But within the confines of my research itself, I had specifically or proposed to look at the experiences as well as the politics that influences immigrant female sex workers' access to PrEP and stuff like. But it's a good point that requires attention as well. Then to Brothers Busiso, yes, USAID withdrawal, it somehow changed the complexion of the game plan because that's why, if you remember well, when I was still in the front, I mentioned that I'm also in a process of trying to rephrase my questions to include, issues that are centered around USAID withdrawal to see how it is going to affect or influence PrEP access and utilization among immigrant female sex workers. But there will always be a way of finding them. The reason probably I couldn't have much time to explain in detail, especially when it comes to my choice of size, the study size themselves. I actually do have people whom I'm actually gonna use as gatekeepers. And on my snowballing sampling technique, those people that I'm gonna use as gatekeepers are the ones that are gonna refer me to potential participants. And these people I'm talking about are these people that I do have some form of, I'm afraid to say personal kind of relationship because it might imply that, but no, but but all I wanna say is like these are people whom I've known for some time, and we actually some of them might do come from same village of origin, and these are people who are open to discuss their challenges, whatever they go through on their daily lives. So and the reason why I'm also going to Deep Sleuth is basically because of those people that I already know. I also once worked there as a research assistant on an IOM commission, the research project where we were looking at the social economic contributions of migrants in informal settlements. And during that time, I managed to make relations with people. And going there, it would be just a matter of one call to say, guys, this is the reason I'm coming there. I wanna talk to this specific type of group of people, and through snowballing, I'm sure that I'll get the number of the participants that I do need.
I actually have a question as well to add on for Bothwell, but I don't want to take up all the time. So is there any other people who would like to ask a question? Sure. Is it to Bothwell or is it to? Okay, so can I ask Bothwell and then you ask Bethsing so that we finish that? Is that okay? And once more online as well. Okay. So it's Bothwell, I guess it's quite interesting when you said, you didn't want to say you have a personal relationship because it once it implies. I mean, as much as it's funny, I also think it's actually a critical point because when you talk about sex workers, they're not just sex workers, right? They're people, and sex work is their job or is something they do to make money. So it's perfectly fine to have a personal relationship with somebody just because they sell sex. I mean, it shows how we kind of, immediately allow that identity or that strategy to take over someone's identity in a way we wouldn't with others. So that's one thing. The other thing is, and it links to this, I feel that at the moment you're making a lot of assumptions not in a bad way, but I think you need to be more curious or unpack things a lot more. So this distinction you're making between migrant or non-migrant, documented, undocumented, there may be literature that points to distinctions, but I mean, I also think there's a lot that points to there not being distinctions or other issues being the key vulnerabilities or risks that are there. So I think, just be sort of read a bit more broadly around that, and also look at, particularly the reports and the work that has come from sex worker organizations themselves, like Sisonke, because I mean, Joe and I have written on this, but we're definitely not the gurus. And there's a lot more that we would love to learn about and know, and that you can ask about, and hopefully we will learn from you as well. And just linked to that again, one last point is around vulnerabilities to gender-based violence. So when I worked with Sonke on a report around police violence against sex workers, what came out, there wasn't a distinction in the vulnerabilities to violence. There was a distinction in the vulnerabilities to the response to that violence and the recourse, right? So somebody who is undocumented is more, I mean, it's generally very hard for a sex worker to report violence, let alone by the police. But when you're undocumented or a cross-border migrant, obviously, then it becomes a lot riskier, and you're pretty much not going, and the police know that, so they use that, right? So it's not that they are, sex workers generally are there's a risk there, but it's what comes afterwards that actually pose a vulnerability. So maybe sort of think a bit more around how we perceive vulnerability and how we think about violence as well in that way. Okay, that's all from me for Bothwell, and you don't need to respond right now because I know we're going to have a chance to talk. Who had their hand up on this side? And then we'll go to once more after that. Do you want to ask?
Okay, so my question is to Blessing. You talked about preparedness. Yes. For my background, I'm from development studies, so we do a lot of. So my honors research, it was about flood disaster preparedness. So we talk about contingent plans. I did not hear you, I did not hear you mentioning that, the contingency plans and stuff like that. I also used the vulnerability framework. There is a healthcare vulnerability framework. You can go and check around that also to include in your research. Yeah.
Thank you so much, Kundai. I think I'll explore that. I'll have a chat with you. Thank you.
Okay, so we just got a question from once more, and then we'll go to, okay. Is it written or? Okay, over to you.
Okay, yeah, I had just posted on the group, checking very briefly with Blessing to perhaps explain more, not much, about introspective observations. It's an interesting methodology for me. So a brief, few sentences would be great to hear.
Did you get that? Okay.
Thank you so much once more. I also did not get much literature on it, but it was worth exploring it. So this is what happens with that. We observe the daily routine that is done or carried out by people with the idea of understanding their past experiences and what is that those routines remind them of the things that has happened before. Thank you.
Thanks so much. And then would you like to ask a question?
Okay, thanks, Blessing. I wanted to ask if you perhaps came across truck drivers who did not want to, reflect on their experiences during COVID-19, maybe because they were traumatic or because they had at some point tried to repress them. And also from your interviews, did you maybe come across anything to do with mental health, how that affected their mental health and how they currently dealing with it? Thanks.
Thank you so much, Melissa. The fieldwork is a mixed bag. Definitely, there are quite a number of people who refuse for different reasons, including those of that COVID-19 would remind of them of instances that they wouldn't want to remember. And just generally, some would just don't want to participate and even chase you away because you remember I said this was their own time and really getting to access to a track and someone said, I'm sleeping when I come back later. And actually I've experienced that several times. And some really accepted. And during the interviews, I have, I think, one interview when the truck driver himself never believed that there was COVID. And he was never really interested in testing and all those COVID measures that were put in place. And unfortunately, one day he decided to go home without knowing whether he had tested positive or what. He just went there. And when he left, he lost his parents. And he says he doesn't forget that. And until today, as he was saying, he hasn't forgiven himself because he doesn't know whether he had COVID, he passed them to his parents or what. So it's something that he still has in his mind. And indeed, there are quite a lot of mental health experiences that were there. Thank you.
Okay, one more from Tifa, and then I think we can wrap up.
Thank you. Mine is directed to Madedido, Mr. Stanley Muraba. It's basically something that I experienced personally in the field working with James, thank you, on other challenging elements of ethics versus cultural norms or expectations. I'll give an example when one of the participants was a church elder and would not respond to anything without two other church deacons or elders. And when it came to reimbursements, who would be the 50 rand for one? Was it appropriate also to somebody with a higher status? And other elements of interviewing a traditional healer? What are the rules? Are we well prepared to go to a house wearing boots and they say, no, I want the interview in my space, remove your shoes at the door? Maybe how people navigated certain challenges like that, cultural norms, religions. Does the enumerator also, are they comfortable to enter those spaces? And also the taboos of money as you experience, to say, how then can you better prepare enumerators when they go in the field, if that's what you want to come out with at the end of the day? Better prepare them, better also improve issues on ethics, because I know some of them are Eurocentric. Are they appropriate? Are they correct in our different spaces as well? I think that will be something of interest. So I just want to know if you have considered that. Thank you.
Thank you very much, Tifa. That's an interesting one. And I think this is exactly what I am looking forward to find out, or to explore from the expert, by the way.
Great. I think we can close there with a round of applause for all of our presenters this afternoon. And just to say thank you so much. I'm going to pass over to Joe, who is going to have a last word, and then we can all head home in search of water.
Thanks, Becky. Thanks, everyone. Huge thanks to Lorena, who I know had to leave. Congratulations to our earlier career colleagues for some really great research pitches. And it's very nice to see the kind of thinking of the PhD right through to the postdoc. And really lovely to see you on the one panel. So huge congrats. And it's exciting to see where everybody is at.